Do not sleep when your stomach is full. I'm sure many of you have heard your elders say that. It's a common superstition among Filipinos that overeating before going to bed can cause someone to have a really bad nightmare and cause them to mysteriously die in their sleep. This belief is popularly known as Bangungot. Actually, there may be a term for that, sudden unexplained cardiac death. And it's not as mysterious as you may think. On the program today, we'll talk more about this condition, how it can lead to a bangungot, and the best ways to prevent and manage it. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk on CNN Philippines. From Japan to Thailand, countries across Asia have different superstitions about those who mysteriously die in their sleep. Here in our country, we call it bangungot. Our guests are here today to tell us more about this phenomenon. With us is Dr. Leonardo Ona III, who is the head of the Metro Manila chapter of the Philippine College of Surgeons and a general surgeon at St. Luke's Global. Also with us is Dr. Ruter Maralit, who is a gastroenterologist from the Philippine General Hospital and the Medical City. Now, a bangungot, or in medical terms, sudden unexplained cardiac death, is actually not as mysterious as one might think. Now, the death is usually thought of to be due to acute pancreatitis. That was the earlier belief. Now, this belief has developed over time. Dr. Ona, could you start off with why would Filipinos have a term for this?
So pag sinabing bangungot dati kasi parang nagmo-moan, masakit ang tiyan, tapos namatay na lang sa tulog. Yun ang kadalasang observation na yun. No? Closest that they could see that causes that would be acute pancreatitis. No? But nowadays, with the advent of technology and good medical treatment in the rest of the country and access to healthcare, hindi na natin nakikita yung mga ganung senaryo na sumakit ang tiyan tapos namatay.
Now, Dr. Ruter, ano ba itong acute pancreatitis? Pwede ba itong mamatay talaga? Could this be one of the reasons why someone could die while asleep?
Acute pancreatitis is basically severe inflammation of the pancreas. So pag sinabi mo may itis, namamaga. So yung pancreas is one of the main organs in the body, the digestive tract, na responsible for digestion. Now, usually, ang presentation kasi ng acute pancreatitis is severe abdominal pain. So yung severe abdominal pain na yan, normally, it radiates pumupunta sa likod. So normally, yung mga patients namin na nakikita namin na may acute pancreatitis, they are awakened. So ginigising sila. So kaya I think the folklore before is kasi marami kang kinain, which is a potential risk factor from pancreatitis. Kaya nagkakaroon daw sila ng bangungot.
Dr. Ona, pwede ba talagang mamatay ang isang tao with just purely acute pancreatitis?
May namamatay talaga, especially the severe hemorrhagic ones. You know, the pancreas produces enzymes that digests a lot of our food, no? The problem is, pag nabaga si pancreas, the enzymes eat up the tissue at nag-i-incite ng maraming inflammation, and the rest of the body reacts to that in the form of sepsis-like cascade. No, you get dehydrated, you lose electrolytes, etc., etc. And if you do not support that, or if you do not treat that, your reserves, nutritional, immune, and etc., will be deranged, and that will lead to really death.
Dr. Ruter, speaking of still on pancreatitis, para aware ang ating yung viewers, what are the risk factors ng pancreatitis?
Okay, there are three main risk factors for acute pancreatitis. The most common is gallstones o yung bato sa abdo. And second would be alcohol. So lalo na alcohol binging the day before or the night before, pwede kang mag-at risk at pancreatitis. And lastly, the third one is hypertriglyceridemia or mataas yung triglyceride sa cholesterol. So these are the three main causes of acute pancreatitis.
How do gallstones enable one to have acute pancreatitis, Dr. Ruter?
There are three main theories. The first one is small stones na nandun sa gallbladder, nalalaglag dun sa collecting tube called the bile duct. And that bile duct has a common channel sa pancreas. Kumbaga meron silang road intersection before it goes to the small intestine. So ang nangyayari, nababarahan yung area ng pancreas o yung yung daanan ng pancreas kaya namamaga. That's one of the theories. Second, baka mamaya there are stones na nagla-lodge o bumabara mismo na galing sa abdomen, nalaglag doon sa pinaka-channel, humaharang. And third, yung pamamaga ng bile duct during the time na may dumaan na stone. So yun yung mga theories about gallstone pancreatitis. So basically, ang predisposition dito, may bato na sila sa abdo and then suddenly a small fragment of that stone went down to that collecting tube, causing that blockage of the pancreatic juice from coming out.
Now, Dr. Ona, what is an acute abdomen? Some people may initially notice this as a pain, but could you explain to us what an acute abdomen is?
It is a lingo for us doctors that will prompt us to investigate more because the urgency of possible surgical intervention will be there. No, the most common source of or reason for acute abdomen would be, of course, your acute appendicitis, pwedeng perforated peptic ulcer, maraming bagay na kailangang operahan kaagad because it causes the pain. No? But not all patients with abdominal pain needs to be operated on. Kaya importante talaga ma-evaluate ng mga doktor, no, to say that it is really an acute abdomen.
Dr. Ona, can any of the diseases that you mentioned, pwede bang mamatay ang isang tao habang tulog, experiencing any of those causes for an acute abdomen?
We seldom see that kasi mabilis na ngayon yung access sa healthcare. But hindi namin madalas makita yan. But if there is a severe rupture of any intestine or anything, and the patient becomes super dehydrated and meron siyang ibang sakit that was aggravated because of that thing that is happening to him, pwede nga siyang mamatay.
So one of the best ways to try and prevent this is to be able to live a healthy lifestyle, avoiding certain risk factors, especially when it comes to infections such as acute pancreatitis. When MedTalk Health Talk returns, we'll talk about what are some of the things that can cause sudden death while asleep. You're watching MedTalk Health Talk, your partner in healthcare. I'm Dr. Freddy Gomez, and welcome back to MedTalk Health Talk, where caring is our calling. There's a long list of theories as to why someone would mysteriously die in their sleep. But one of the more common things, especially in Filipino folklore, is that it is from acute pancreatitis. But now we are shedding more light on other possible causes for this, as well as things that you can do to keep your pancreas healthy. Dr. Ruther, talk to us about alcohol intake. Marami ang umiinom ng alcohol, they enjoy drinking alcohol, but only think that their liver is the one stressed or affected whenever they do binge drinking. Could you explain how the pancreas is affected?
One of the main reasons there is an increased risk of pancreatitis because the alcohol sensitizes the pancreas to create more enzymes, these digestive enzymes that causes the digestion of food. The problem is it causes malfunction. So, ang nangyayari, because of that increased sensitivity, there is that damage inside the pancreas that is then causing an auto-cascade event, meaning a domino effect, causing the pancreatic enzymes to destroy the actual pancreas. So, instead of digesting food, it digests the pancreas. So yun yung nangyayari when you binge in alcohol. So that's why we advise patients to have had an history of acute pancreatitis to stay away from alcohol as much as possible.
So aside from the severe pain, Dr. Ruther, what other red flags would someone feel kapag nag-uumpisa na ang acute pancreatitis?
Okay, acute pancreatitis is always associated with very severe abdominal pain. Pag pinapatanong mo yung mga pasyente, Doc, 10/10 po yung tindi ng pain. It's usually nasa gitna, no, above the umbilicus na pumupunta sa likod. There's no position, no, sasabihin sa'yo ng pasyente, Doc, hindi ko po alam kung saan ako lulugar. pero sobrang sakit. Even intake of fluids, kahit water, may exacerbate o lalong palalain yung symptoms ng pancreatitis. That's why ang sinasabi natin, it's severe pain, it radiates to the back, and then hindi makainom or makakain yung patient. So these are the classic symptoms of pancreatitis.
Dr. Ruther, what is the first-line treatment of this kapag pumunta na yung pasyente na diagnose na siya with acute pancreatitis?
There are three mainstays of treatment of pancreatitis, acute pancreatitis. One, we place the patient on nothing by mouth. Wala talaga silang pwedeng kainin or inumin. Second, we hydrate the patient. So, syempre, dahil hindi sila pwedeng kumain or uminom, usually it requires hospitalization at sa swero binibigay yung pag-hydrate o pagbibigay ng swero, no? And lastly, pain control. Because severe pancreatitis is associated with severe pain, nagbibigay kami ng pain medications to control the pain.
Now, Dr. Ruther, let's go back to the notion or the phenomenon of bangungot. We've established that pancreatitis could be one of the reasons, but it is definitely not the only reason why someone could die in their sleep. What could be other possible causes for someone to experience death while they are asleep?
The many causes that have been identified are mainly sa puso galing cardiac. So, ang nangyayari, there's irregular rhythm, so biglang nagde-develop. So, majority of patients who die suddenly in their sleeps have parang pre-existing o meron na talaga silang sakit sa puso. But there are about 10 to 15% of patients na hindi alam kung bakit. So, or hindi lang na-imbestigahan. But mainly, puso talaga. So marami yun. Prolonged QT syndrome, Brugada syndrome. These are medical terms that we usually investigate or patients who have experienced sudden cardiac death. So mainly cardiac talaga yung iniisip na kasalanan.
Punta tayo naman sa notion na kumain ng marami bago matulog or naging busog bago matulog. Does this have any link or connection with any of the disease entities that may cause death while asleep?
Ang naisip lang namin most likely is yun nga kung severe pancreatitis. However, severe pancreatitis is one of the parang smaller possibilities because of the unlikely presentation. Usually, pancreatitis are severe in pain. Itong mga to, natulog lang. So, what else? You can also have yung tinatawag nating heart attacks. Heart attacks, especially doon sa tinatawag na mababang part, yung inferior wall, yung mababang portion ng wall ng puso because it can present with epigastric pain na kaya pwedeng mag-moan yung patient, akala nila stomach yung kino-complain. But again, cardiac pa rin yung iisipin mo bago mo isipin yung GI as a cause of bangungot.
There are much better tools nowadays for the doctor, for the surgeon, in order to diagnose a problem. What are some of these tools that doctors use that can narrow in or to zero in on a correct diagnosis?
Well, for pancreatitis, the computed tomography, or what we usually term as CT scan, is quite essential for us because we can actually see the pancreas, if it is inflamed or not, or if there is a collection of fluids or blood, no, what we call hemorrhagic pancreatitis, no. These are giving us guides, no, on the severity of the disease.
When it comes to gallstones, a lot of people are still unsure. Ito ba ay ginagamot or surgical treatment na ang mas maganda?
Gallstones per se do not require surgery to be done, no? Especially if the patient is not symptomatic, no? Kung wala namang nararamdaman and the gallstone was just discovered incidentally, then pwede natin obserbahan. There's a good number of patients, I think about almost 30% subset of patients who have gallstones and they reach the end of their lives without anything happening to them because of that gallstone, no? But however, if you are symptomatic already and it's causing you pain, bloatedness, etc., and discomfort, then you will really need to have the gallbladder removed. No?
While acute pancreatitis is a serious condition, there are effective ways to stop it in its tracks. We'll give you some vital tips when we return. Your health is our mission here on MedTalk Health Talk. We'll be right back. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk, your partner in healthcare. When you feel a searing pain in your upper abdomen, this could signify or be a risk factor for something more serious. So don't discount this, and we'll give you some tips on how to give your whole body and your GI system a healthy makeover. Dr. Reuter, could you tell us more about how to keep someone's gastrointestinal system healthy, their pancreas, their liver, and everything else? Are there any basic information when it comes to gastrointestinal health?
So definitely avoid alcohol as much as possible and do not smoke. And then second would be probably avoid binge eating. And then lastly, seek consult for patients who are 50 years old and above, because colon cancer is one of the most common top 5 cancer in the Philippines, and colon cancer can actually be prevented by having certain tests and colonoscopy done so that you don't develop the cancer.
Dr. Ona, kapag ang gallbladder ng isang tao ay tinanggal na, post-operatively, ano ang mga bawal ng mangyari sa isang taong wala ng gallbladder?
Sinasabi ko sa pasyente ko, bawal lang hindi masarap, no? But, you still produce the bile that is needed because that is produced by the liver. You just don't have the extra bile that you might require if you eat too much fatty foods, no? The dictum is, if you have your gallbladder removed, you avoid the extra fat. Pag kumain ka ng barbecue, pagdating mo sa dulo, medyo isipin mo na, sabi ni Dr. Ona, wag ko na kainin yung extra na yun. No? So, easy on the fat because especially the dairies, no? Because they will, they might cause you some discomfort, no, in your abdomen, but nothing too serious.
Now, Dr. Reuter, when it comes to the phenomenon of bangungot and its probable causes, what advice can you give our viewers with regards to that?
If you're young and healthy, probably you need just one checkup and then have yourself checked it with the heart. Now, for patients who have had a family history of bangungot or sudden cardiac death, then there may be some tests that may be needed, especially for younger males, no, 20s to 40s. Sila po yung mga mas magbe-benefit on further workup because there are some genetic testing that can be done, then there's some cardiac MRIs that can be done. ECGs can also be done for patients who may have a family history ng bangungot.
And Dr. Ona, do you have any good advice para sa mga viewers when it comes to the notion ng bangungot and its probable causes?
Well, you have to eat healthy. A lot of fruits, a lot of vegetables. You lessen the meat. Do everything in moderation. Your checkup with the doctor is important, especially if you are considered high risk for developing cancer in the family. You have to have that screening done on the right age.
Now, at the start of the show, we discussed that acute pancreatitis is one of the known explanations of sudden unexplained cardiac death. And while studies may point to this, we want to remind you that there might be other medical conditions that could lead to this. Ultimately, we have control over our well-being. Eating healthy and exercising and being proactive with our health are key steps in preventing many diseases and protecting your health. Thank you, General Surgeon Dr. Leonardo Ono III and gastroenterologist Dr. Reuter Maralit for sharing with us your insight and your expertise. Maraming salamat sa inyo. I'm Dr. Freddy Gomez, and thank you for watching MedTalk Health Talk on CNN Philippines. We'll see you again next time.